Hey, so I wanted to make a quick vlog on me getting a nose job, and I just wanted to have it up there, I guess maybe for me, just for memories of what my nose used to look like and what it will look like, and probably talk about all the pain or all the suggestions or any ideas I get to be able to recover and cope the best I can. So I am getting my nose job actually in like 6 hours. My surgery is tomorrow, so pretty nervous, so I'm not wearing any makeup so that you can see like my nose, and everything that I'm going to do to it. So I'll just take a little close up here. But if you see, oh yeah, that's getting removed tomorrow. I am going to be getting, a nostril reduction. We're gonna go ahead and, if you can see, like kind of lift this up. And then I think we're just gonna thin out my nose so it's a little bit more, maybe not pointed, but definitely less bulbousy. So that's the stuff that's gonna be done today. As you can see, I have a pretty small bridge or whatever you call this up here. So this is all good. It's just really all focused down here. So everything's gonna be little. I'm pretty excited. I've been watching vlogs and everything. So everyone's different, and my nose, luckily, I think it's just gonna be mainly cartilage that's gonna be worked on, not like up here or anything, but who knows. I'm gonna be knocked out, so how am I supposed to know what they're gonna work on? So I will be posting it. Yeah, tomorrow's the day. I'll be probably not, obviously I can't record the surgery during it. I wish I could, but whatever. I'll just record my way on my way over there and talking to the doctor, and then the results afterwards. I just met with the doctor. I'm waiting for the anesthesiologist. They're gonna do all this stuff to my nose. It's gonna be different. I'm excited. Can't wait. Hey, so this is post-op. It's been a few hours since I got out of the surgery. I am so swollen everywhere. I am not in that much pain, believe it or not, but I was pumped up with drugs when I was under the anesthesia. So and I just took some antibiotics. I haven't taken any pain meds or any nausea because I haven't been feeling dizzy. But if you could see, I talk like a weirdo. I already changed my gauze pad once because that shit was full of blood, and I am swollen everywhere. So if you could see, I've been sleeping on and off on the couch all day. Probably not gonna leave the couch for at least 2 days because I live in a 2th floor and I don't want to climb those stairs. So this is day 1 post-op, and it's not so bad, believe it or not. So as of day 1, I've only been drinking liquids. It's kind of really hard to drink liquids, definitely too hard to eat. My teeth hurt for some reason. But you need to breathe through your nose to be able to swallow. At least air goes through it, and it's I just feel it. I'm scared that I don't know, the liquids go through my nose or something because of the way I'm eating or drinking. So I had my mom make me a shake, and that is where I'm getting all my protein and everything, because I know I'm gonna lose a lot of muscle, but I want to try to at least maintain something. So excuse the terrible lighting, but I've been sleeping in this shirt all day because this is easy to zip down in case I want to shower, which I can, but I've totally bled all over it. But I just wanted to make note of that. I'm sorry. I have 2 incisions on my face. It's kind of hard to see because it's bloody, but I don't know why they weren't covered up. So that's a question I'm gonna ask the doctor tomorrow, or the nurse, whoever talks to me, as to why I have 2 incisions on my face that don't stop bleeding and why they weren't taped up or anything. I don't know if they just didn't notice or what. And I'm bleeding heavily. I've been cleaning this constantly. I'm gonna go put ice over my face in a minute. I haven't really been doing the compresses, but I have to go do that. But I'm just afraid of putting the big bag of peas over my nose because it's so sensitive. But I am still feeling pretty good, so I do not want anyone to think that nose jobs are painful. No, I'm sorry. That is not what I meant. They're probably painful, but it's not so bad. So not to be afraid of getting your nose done, because it isn't. It's been really good so far. And, you know, I have to kind of sleep sitting up and stuff. That's why I've been on this couch. It's pretty comfortable. But, I mean, 10/10, if you want to get a nose job, get it. You'll be fine. Hey, so we're in day 2. And I was feeling okay this morning, but I think all the medication from yesterday and everything else is like wearing off. So I was starting to feel like pretty in pain. So I took half an oxy because I don't want to take the whole thing because I don't want to fall asleep. I've been sleeping already enough. And I'm freezing. So I don't know. I'm hoping I don't catch a fever, but I'm feeling pretty warm. I'm freezing. The air is up. I felt good outside, but I can't be out in the sun. So that's not going to help me. So I'm just wearing all of this sweater. Yeah. Then I got an E3, by the way, last year. But anyway, this is what I look like. The tape, I can't remove it, so it's just all the blood that I've had since yesterday. Gross, but whatever. And hopefully I feel better by the end of the day. Alright, this is day 3. I got that John Legend smile. I am so swollen. I thought I was gonna get better by day 3 and I just got worse. Ooh-wee. We're just ordinary people. We're just here to take it slow. Take it slow. Hey, so it's Friday, day 5. I skipped, you know, day 4 just because I kind of look. This is more or less what I look like. The swelling is going down a lot better. But, I mean, there's obviously still swelling. So I still got bruising on my eyes. And weirdly enough, I got like, look, I got a bruise on my eyelid, on my eyeball, I mean. So that's kind of weird, but I guess it'll go away. I just couldn't handle all the grossness, so I've been cutting away at the bandage only until I have the splint left. I won't take that off, but it's gonna be so hard not to like want to scratch it. But if you see stitches, you know, they're healing pretty good. I've cleaned up as much as I could just because I couldn't take it. I can't take all that blood. It's just so gross. So I'm looking good. I'm gonna keep icing. I finally can breathe through my nostrils because I've been having such crazy problems sleeping because I can only breathe through my mouth and then my mouth dries up and that wakes me up. And so like I was prescribed sleeping pills, but I didn't take them because I don't want to be on all these different pills. I did develop nausea yesterday and the day before, and anytime I eat I get nausea, so I have been starting to take my nausea pills. I just take one and it immediately goes away after I eat. And I'm all out of my antibiotics. And that's the progress so far. So it's been, I mean, I should swell down maybe by Monday. Maybe the bruising will be kind of gone, and Monday is when I get my my splint taken off and everything checked. So far, yeah, I'm looking like different. I'm still swollen, so this is not the final result, but I'm pretty excited. So it's looking pretty cute. And look, I can breathe through my nose.
Every patient, not every, but so many patients do that. You want up having a little more swelling here longer than usual, but that's okay. Okay, so we did what we planned to do last week. It was Monday, right? So Jennifer had a little bit of a bump on her bridge. We took that down, but most of the problem was that her tip, right, was too wide. And her nostrils were flared. So through a close approach here, we were able to get to what we call the tip defining point. Well, I mean, at home, we won't tell anyone how we do it, but we did it. But you'll see your tip is so much more beautiful than it was before. Now, this is not the final result, obviously. You're just a week out, right?
Yeah, just a week. Wow.
Looks pretty good so far, huh?
Yeah, my bird was trying to attack me.
Your bird?
Yeah,
You have a bird?
Yeah, I have
She
a
didn't know who
bird.
you were?
No, she didn't. And I was like,
She didn't like our nose job?
well, my entire face was swollen. I was like, oh no. It took like 4 months to get her to like me. But
What do
now
you mean, since when? Oh, it's when you first got her.
When I first got her, yeah. She's been, how long has she been?
What kind of bird are we talking
It's
about?
a kike. Do I have anything in my nostrils?
There are stitches inside.
Oh, do they dissolve?
The rest are absorbed. The ones that are on the outside we took out already.
Oh,
So then you don't have to worry about. Okay, give your nose about 6 months to be 95% of what it's ultimately going to look like. You know what I mean?
Okay. Yeah.
You're only a week.
Yeah, it's only. Oh, what about the? I have a bruise on my eye. Like,
Yeah, it's always the case.
Oh, so it's a normal and it goes away.
Actually, that's not a lot of bruising for noses. It happens because we narrowed your nose by moving the bones around a little bit.
Oh.
So.
Yeah, because I have
You
like
can't
that
even
big
see it.
gash in my eye.
Oh gosh, but this is just bruising.
Oh yeah. Just the one in my eyeball.
On this side.
On this side. Like,
Yeah,
see?
their left side. Oh, it's
So
not.
what? Oh, inside the eye?
Yeah,
yeah.
Sometimes bruising can actually go inside.
Yeah, it's weird. So as you saw in the unveiling of my nose, this is the final result. Well, it's not final because it's still a little bit swollen, but this is post-op 1 week, and I am extra happy with the job. The nose is pretty symmetrical. That's what I was actually mainly worried about, the nostrils, I mean. And I mean, it's just super straight. I'm just super happy. So my bird is chirping in approval. So I'll probably post like maybe a photo or a video, short video after a month when most of the swelling should go down. But it takes about 6 months to a year to fully heal. But I am happy. So I definitely recommend the nose job. It doesn't hurt as bad as it appeared because I know I was pretty swollen. It's recovery is fairly quick. I mean, this was only a week. Yeah, I have like, some bruising still, but I think everybody is different. It depends on how much they rested and maybe how much ice they applied in the beginning, or it's just, I don't know, everybody's different. So I'm pretty happy with the results. And if you're considering a nose job, always consult, your doctor, ask whatever questions you need to ask. And if you guys have any questions, just drop something in the comments if I missed anything. So thank you so much, and I will come back in a month.